Welcome, Gold delegates. I'm Fleur Bickford, Program Director and MC for Gold Perinatal 2015. And I'm here today with Dr. Nicholas Embleton, talking about his upcoming presentation titled Milk and Gut Microbes, Early Feeding and Outcomes in Preterm and Term Neonates. So, Dr. Embleton, thank you so much for being with us today to answer a few questions. And to start with, I'm hoping that you can just tell us a little bit about your professional journey and how you became interested in studying neonatal nutrition.
Yeah, sure. Thank you very much for inviting me to participate in this conference. I've worked as a neonatal pediatrician for about 25 years. I started my medical training back in the 80s, a long time ago now, and qualified in 1990. And for the first few years after qualification, worked primarily as a pediatrician in training. But mainly in the late 90s, moved mainly into neonatal work and undertook some research looking at protein requirements in preterm babies. And really my interest in nutrition has grown since that time. Back then I think we were very unaware of how early nutrition programmed later outcomes. But there's now been enormous work in the last 10 or 20 years showing us that how we feed babies in early life, particularly the role of breast milk, but also lots of other things, how these have really long-term effects throughout the life course, and so showing us the importance of early life and, say, particularly breast milk exposure on a range of health and disease outcomes in adults.
Okay, thank you. So we're definitely starting to see more and more research into the microbiome. So I'm wondering if you can just tell us a little more. I know you just touched on it, but if you could tell us briefly, why are more people really paying attention to this now? Why are we starting to see this big amount of research suddenly coming out about this?
Yeah, you're absolutely right. I think one of the reasons is up until sort of 5 or 10 years ago, we simply didn't have the right scientific techniques to explore the microbiome, and particularly the gut microbiota. And in the past, we were only able really to identify organisms if we could culture them, grow them on a dish in the laboratory. But in the last 10 years, people have developed these new technologies that identify bacteria by looking for their genes, the genetic sequences, the bacterial RNA. And this has allowed us to identify many more species than we would ever have thought possible. And as I'll touch on in my presentation, probably we have around 2,000 different species living within our guts. But up until 5 or 10 years ago, we really could only identify maybe 300 or 400 of these. So these new scientific techniques have really allowed us to discover something that we never really knew existed before. And the more work that's going on, the more highly relevant we're starting to realize the importance of early bacterial colonization, both in term babies, but also in premature babies, and the relationship between these bacteria and some of the serious problems we see with our premature babies, such as sepsis and necrotizing enterocolitis. So I think that a lot of the emerging interest in the last few years has been due to development of scientific techniques that we simply never had available in the past.
Okay, it's interesting. It's amazing how, as technology improves, the more and more we're learning. So another question for you, you just touched on it briefly, but just wondering for anybody who is, really unfamiliar with the microbiome, can you just briefly tell us about why the gut is so important? It's, I think in the past we've always kind of, we haven't really given it much thought. So can you just tell us really briefly about why we should be paying more attention to what's going on in the gut?
Well, there's a lot of evidence now from all kinds of different situations, not just in babies, but in older children, in adults, and even in older age, showing relationships between the types of bacteria we have in the gut and some very important diseases such as diabetes, but also osteoporosis, Alzheimer's, depression, which show that probably some of the functions of gut bacteria in terms of the sorts of compounds and molecules that they produce. But these gut bacteria really are profoundly important in all aspects of health and disease. And every month, more and more data come out to link the gut bacteria with all these outcomes. And in neonates and pediatrics, we're starting to recognize that some of these diseases that we thought didn't really have a clear explanation as to why they were occurring may again be related to patterns of gut bacteria. So there is now work looking at children with autism and hyperactivity disorders showing that the patterns of gut bacteria that they have may be one of the reasons why those children develop those symptoms. So a very, very complex area, but deeply, deeply fascinating for us to realize that there's actually much more going on in our bodies than we ever appreciated before, and that lots of the metabolic processes going on inside our body are not really human processes, but bacterial processes. So really, really fascinating, and I hope that the delegates today take some of the excitement that we found away with them.
Thank you. It is definitely very fascinating, and I know that I am really looking forward to your presentation. Can you just briefly tell us a little bit along with that sort of fascination and excitement, what else are you hoping that delegates will take away from your presentation? What sort of things do you hope they're going to learn and be able to take forward with them?
Well, I suppose in thinking about kind of normal term babies, really just to highlight that humans have evolved over hundreds of thousands of years to be optimally suited to their environment. And that normal process then of normal vaginal delivery and breast milk feeding is crucial for determining how well suited we are. And I fully recognize the reasons why people might have cesarean sections, and I fully appreciate that for some women breastfeeding is very complex and doesn't always work out. But really to try and encourage practitioners that the normal pattern of delivery and feeding, i.e. normal vaginal delivery and breast milk feeding, is what we should be aiming for, that we should be trying to encourage this in our colleagues and encourage society that this is the best way suited, because as some of the data I'll show you, it does seem that changing this, so for example delivering by cesarean section rather than normal delivery, changing this at a very early stage in life may well have profound influences as we grow up. So the decision about what's best for any particular mother and a baby really needs to be taken in the context of understanding all your health and disease over the life course, and not just focusing on the here and now. And hopefully it will be another reason to help persuade mothers and wider society of the importance of supporting breastfeeding.
Okay, wonderful. Thank you so much. And definitely, very good point there that we always have to be aware of the consequences of our actions, and really such a fascinating topic that we're just starting to learn more about. So really looking forward to hearing more during your presentation. So thank you so much for being with us here today.
Thank you.
So for our delegates, you will be able to learn more about this fascinating topic on Dr. Embleton's live day, which is October 20th, 2015 at 1300 UTC. That will be his live presentation. And of course, the recording will be available throughout the duration of the conference. We look forward to seeing you then.